This brief learning module, COVID-19 Identification and Prevention Report, will help you know when and how to report potential signs and symptoms of COVID-19 in residents. Mrs. Perez has been a nursing home resident for 8 months. She is alert, talkative, and enjoys visiting with her nursing assistant, Ellen. Mrs. Perez likes to show Ellen pictures of her grandchildren when Ellen is in her room making rounds. One day, just as Ellen was about to check on Mrs. Perez, the supervisor stopped her. Mrs. Perez's son had called and was worried about his mother. When he spoke to her earlier, she sounded out of breath and uncomfortable. Armed with this information, Ellen gathered personal protective equipment before checking on Mrs. Perez. Ellen noticed she was inactive and very quiet, and that was unusual for her at this time of day. Mrs. Perez seemed very tired. When Ellen gently touched her arm to say hello, Mrs. Perez was warm and said her legs and neck were sore. When she tried to talk to Ellen, she started coughing. She was short of breath, which was unusual. Ellen immediately knew something was wrong and took Mrs. Perez's vital signs, including pulse oximetry, which measures her blood oxygen levels. Since the pandemic started, Ellen has learned to recognize what signs and symptoms to watch for in residents who may have the COVID-19 virus. A fever, muscle aches, cough, and shortness of breath are some possible symptoms of the virus. After taking her vital signs, Ellen told Mrs. Perez that she wanted to talk to her supervisor, but would be back soon. Ellen immediately went to the supervisor to report Mrs. Perez's vital signs and the changes she noticed in her behavior. After talking with the supervisor, Ellen tried to remember if any other residents or visitors had spent time with Mrs. Perez recently. Outside visitors could be carriers of the COVID-19 virus, and any other residents and staff who were in contact with Mrs. Perez could be at risk for infection. Viruses can spread quickly, maybe even resulting in an outbreak. Ellen's supervisor immediately notified the infection control nurse on staff, and Mrs. Perez was put on airborne and contact precautions while awaiting her test results. Protocols were put into place to prevent the virus from spreading. Fortunately, the COVID-19 test was negative for Mrs. Perez and Ellen. It turned out that Mrs. Perez had the flu. The flu still requires droplet precautions and isolation of infected residents, as this can cause severe disease in the nursing home setting. After Mrs. Perez's symptoms resolved, transmission-based precautions or extra safety measures were lifted. Ellen was relieved Mrs. Perez was feeling better, and staff took measures to control a possible flu outbreak in the nursing home. Not only would residents have been at risk, but staff would have been too. Ellen was glad she reported Mrs. Perez's sudden change in condition and prevented a potential outbreak. The supervisor said Ellen did the right thing and thanked her. She also told Ellen not to hesitate if she noticed changes or new symptoms in a resident. This time, the test results were negative for COVID-19, but her quick action of reporting a potential infectious illness saved others from illness or even death from a flu outbreak. Now let's review a few key points. Think about the best answer for each of the following questions. Why did Ellen notify her supervisor that she was concerned Mrs. Perez could potentially have COVID-19? Mrs. Perez was showing common symptoms of the COVID-19 virus, including a fever, muscle aches, coughing, and shortness of breath. What did Ellen do as soon as she recognized potential COVID-19 symptoms? She immediately reported the resident's change in condition to her supervisor. You see your residents every day and have developed relationships with them. You are a meaningful part of their lives and know their personality and behaviors. If you feel one of your residents may not be feeling well, even if they are not displaying the most common symptoms of the COVID-19 virus, notify your supervisor. It may prevent the spread of a virus and save lives. You have completed this learning module. We hope you have learned some tips to help protect yourself, your residents, visitors, and other staff from a potential COVID-19 outbreak at your nursing home. Learn more. Watch the next video in this series to learn why we cannot let our guard down when it comes to COVID-19. And visit the Agency for Healthcare Research and Quality's website for free tools to help you identify and treat COVID-19.